Often we see patients coming with different scans done at various centers, and we find that, we have to repeat it because the sequences are not appropriate. Why is it important to have a team approach when it comes to treating cancers? Why not just a standalone surgeon or a standalone medical oncologist or a radiation oncologist treat the patient? What's the difference? So when a patient walks into our center at the Nanavati Max Institute of Cancer Care, this patient has the benefit of getting all services pertaining to cancer treatment under one roof. It starts with diagnostics, whether it is radiology, whether it is pathology, whether it is biopsies by our very, very expert interventional radiologists or by our endoscopists, gastroenterologists. So this is the first part where the diagnosis is accurate. Usually within 48 to 72 hours, the patient is worked up. Often what happens is when the patient comes and sees us, we would advise a particular sequence of MRIs or a particular sequence in CT scans, which makes a big difference in the type of information that we need. So it really cuts down the time needed to complete the workup. We also have a very expert team of gastroenterologists who provide the entire range of services, whether it comes to endoscopy, colonoscopy, endoscopic ultrasound, ERCPs, etc. So trained pathologists who are trained in oncology, very, very important in identifying those particular molecules, and the effectivity of the chemotherapy is going to be better. Most patients would either come to us, the surgeons, or to the medical oncologist or the radiation oncologist. Whoever they go to, they get the advantage of a team seeing this patient and assessing the patient. If a patient comes to me, I will always involve the medical oncologist and the radiation oncologist, possibly on the same day. If there's something to be discussed, if there's something to be deliberated, debated, we do it right then and there, what we call as a tumor board, where this patient is discussed and appropriate line of management is planned. Once surgery is done, the team not only includes the oncologists, but it also includes a large number of other associated specialties. Nursing is very important. We've got stoma nurse, who is a huge asset to our team, who actually takes care of patients with colostomies or stoma bags. There's a wound care nurse who takes care of various wounds, dressings, etc. There are the entire gamut of physiotherapists who help the patient recover. There are dieticians who are trained in oncology. The requirements of oncology patients are different from other patients. So under one roof, we have every single specialist, whether it's a doctor, whether it's a nurse, whether it's a dietitian, all the entire paraphernalia associated with the cancer treatment is all available under one roof. And that makes a huge difference when it comes to the recovery of the patient and giving the patient the best possible outcomes. We also sometimes involve psychologists or psychiatrists to build up the emotional quotient of the patient and the relatives. And it's the entire team effort that actually helps navigate the patient and the family through this very, very difficult time. And I think that's where the team approach has really helped us. Thank you.